Kalangala is a home for about 60,000 people. It's one of the districts whose geographical terrain limits most people from accessing health services. The main mode of transport used to access health facilities is by boat, which is quite irregular and expensive for individuals to afford. As a result, the district continues to register rampant prevalence of various preventable and treatable diseases. The district has 84 islands with substantial vulnerable populations of fisherfolk and plantation workers. The district has 2 health center 4s, 6 health center 3s, 7 health center 2s, and 4 registered private clinics.
Honorable Minister, Chairman, ladies and gentlemen, my name is Professor George Kiria. One of the founder members of UHMG. UHMG is actually Uganda Health Marketing Group.
Working closely with health workers from the local health facilities and other implementing and corporate partners, UHMG mobilized resources to offer free integrated health services to the underserved communities in Kalangala. The 2-day health camp that took place from 20th to 21st June 2015 was held at Mulabana Health Center 2 and Oil Palm Uganda Limited Camp, respectively. I came here at 1 a.m. in the night. I live in Nakatiba, a few miles away, and it's the nearest landing site of all landing sites around this particular island. My name is Restina Joko. I live at Nakatiba landing site. I came here at 5 a.m. and I found 16 people already here. Some arrived as early as 1 a.m. I came early because I know these islands are full of people in need of health services. The people that accessed the free health services came from 5 sub-counties of Kalangala district, namely Kalangala Town Council, Bujumba sub-county, Mugoye sub-county, Bubeke sub-county, Mazinga and Chamswa sub-county.
Certain months when people are very many, when the fish catch is very high. I think the fisheries people can tell us. Okay. But when I go to the landing sites, to the other islands, you find in some months people are very many, and when you ask why, they say the catches are good. Okay. The biggest challenge I have in the district as the DHO is a very high HIV prevalence. Yeah, our prevalence is very high. It's about 4 times the national prevalence. Yeah, this mode of delivering services in Kalangala is very good. I think it's the best mode that we can use as a district to provide services to the people.
UHMG worked with a number of implementing partners and corporate companies to deliver the free health services to the people of Kalangala. Some of the partners were represented during the health camp.
Abakulu aba UHMG, bapartners baffe bonna bali wano, banyabo ne bassebo mbalamusiza mwenna. Mwebala okujja kubanga oluusi omuntu ayinza okukola camp abantu ne batajja. You are aware that Kalangala has 84 islands. Of these, as said by the district chairman, 64 are actually occupied. There are people in these 64 islands. We don't have health workers or health facilities in all these 64 islands. And the reason is because movement to these islands is a bit of a challenge. So I want to also inform the people of Kalangala that we are going to bring to you 2 motorized boats specifically to take our health workers to those islands where there are no facilities so that they can do outreaches and reach out to the population.
The Kalangala Health Camp was graced by the Minister of Health in charge of primary health care, Honorable Sarah Opendi. The minister participated in the health camp by immunizing one of the babies that had been brought to the health camp by their mothers.
My name is Maureen Chomhendo. I'm the Public Affairs and Communications Manager for Century Bottling Company, bottlers of Coca-Cola products in Uganda. For Coca-Cola, our expertise is in bottling and distributing Coca-Cola products. However, for us to be able to have the impact that we are looking for in informing health communities, we partner with organizations that are of international and or national repute, such as UHMG, because they have the footprint, they have the presence, they have the expertise, and they work with communities better than anyone.
UHMG is a very big and well-structured organization working all over Uganda to improve the lives of people. We partnered with UHMG because we know they do a good job for the people.
I work with Smart Stops International Uganda. We offer family planning, all methods, temporary, long-term methods and permanent methods.
Through the camp, UHMG also distributed medical equipment, medicines, and assorted items to support continuous improvement of service delivery. The items were given to Mulabana Health Center 2, Oil Palm Uganda Limited Medical Facility, and Walter Good Life Clinic. The items included 3 delivery beds, 10 color-coded waste bins, and assorted medicines.
If you are on an island and the health center that is supposed to serve you is on another island, it is impossible, almost. It's very expensive for this mother who has a sick child who needs a service on another island. This mother can't afford the cost of transporting this child from one island to another. Next time, I suggest we move to an island and provide the same service there. It comes along with some challenges, especially facilitations and transportation of the patients to the camping site. It will become more expensive to triple the cost that UHMG has spent here. Yeah.
There are conditions that people have here that people in Kampala, people in towns don't have. You cannot, they have been eradicated from the cities, if I may say. So these diseases they have are actually treatable and we can get rid of. Yesterday you people were seeing people from Kachang. They would have
remained there. Full stop.
Even as they come now, they expect a lot, Katibab. They expect a lot only to come here to tell them that this one we don't have, this one we don't have. But at least you came.
The Kalangala Health Camp enabled people to receive integrated services including HIV prevention care and treatment, client education, HIV counseling and testing, voluntary medical male circumcision, elimination of mother-to-child transmission of HIV, HIV care and antiretroviral therapy, management of communicable diseases, sexually transmitted diseases, malaria, diarrhea, pneumonia, immunization and skin diseases, management of non-communicable diseases, blood pressure checkups, treatment, blood sugar checkups and referrals, dental care, eye care and reproductive health.
I must say that I'm extremely impressed, first and foremost, by the turn-up of the people. I feel that the figure of 9,000, which we expect this camp to bring, may be excelled if I take what is here.
Without politics, this is a good thing. It is fantastic. And if it wasn't, I would not have told you that. For sure, it is good. And I think we need to have this more often than not. If we can have it 3 times in a year, that would be lovely. And I think we need to enrich it with some other instruments, some gadgets that we can use for investigations. As you may well understand, the camp is good. We have a lot of specialists, but they cannot do much without those tools.
I think of all the camps UHMG has done, this is the best health camp so far.
What has impressed me today is that the mobilization was very good, despite the area we are working in, and mobilizing from different areas to come, take up these services.
Obulamu bagambye nti tusiimira ddala n'okutwongerayo.
Once again, as UHMG, we wish to acknowledge in a special way the support given by the partners below in making the camp a memorable success. Ministry of Health, United States Agency for International Development, Kalangala District Local Government, International AIDS Vaccine Initiative, Obulamu Campaign under the Communication for Health Communities Project, Total Uganda, Century Bottling Company Coca-Cola, DFCU Bank, Abacus Pharmaceuticals, Action Aid, Save One Mom Uganda, Quality Chemicals, Maristops International Uganda, Boots Pharmaceuticals Limited, Oil Palm Uganda Limited, MedLink, Sajek Company, Kalangala People Living with HIV/AIDS, The Press, Vision Group and The Observer, and Kalangala Bukede Club.